It has become so normal that you barely notice it anymore. You are sitting in the living room in the middle of the afternoon. The house is a comfortable temperature. Everyone else seems fine. But your feet are cold. Not the kind of cold that comes from being outside in January. The kind of cold that is just always there. The kind you have learned to work around. You keep slippers by the chair. You wear socks to bed even in summer. You have stopped mentioning it because the answer is always the same. You just have poor circulation, or that happens when you get older, or nothing at all. Just a sympathetic nod and a change of subject. And so you have accepted it. Filed it under the long list of things that are different now than they were at 50. Just one of those things. I want to challenge that today. Not because cold feet are always a sign of something serious. Sometimes they are not. But because in adults over 60, persistently cold feet are one of the most reliable early signals of a process happening inside your blood vessels that deserves your attention long before it produces symptoms that are impossible to ignore. And by the time it produces those impossible to ignore symptoms, the window for the easiest intervention has often already closed. My name is Dr. James Harlow. I have practiced internal medicine and cardiology for over 25 years. And what I want to do today is tell you exactly what your cold feet may be communicating, in plain language, without the kind of medical terminology that makes people's eyes glaze over, and give you a clear picture of what warrants a conversation with your doctor and what does not. Let me start with the basic biology because it is actually quite simple once you see it the right way. Your body has one non-negotiable priority when it comes to blood flow. Keep the vital organs, your heart, your brain, your kidneys, warm and well supplied at all times. Everything else is secondary. When circulation becomes compromised for any reason, the body does not distribute the shortage evenly. It protects the center and reduces flow to the extremities, your hands, your ears, and most significantly, your feet. Think of it like a city managing a power shortage. The hospitals and emergency services stay on. The traffic lights in the outer neighborhoods go dark first. Your feet are the outer neighborhoods. Cold feet, in this context, are not a problem with your feet. They are a message from the distribution system, from the network of arteries and vessels that carries warm, oxygenated blood from your heart all the way to your toes. When that message is persistent, not just on a cold morning, not just after sitting still for an hour, but consistently, day after day, in conditions where the rest of your body is comfortable, the distribution system is telling you something worth hearing. The most important cause I want to discuss, the one that changes the clinical conversation from just poor circulation to something requiring real medical evaluation, is called peripheral arterial disease. I know that is a clinical term. Let me translate it into what it actually means in your body. Your arteries are supposed to be smooth and flexible on the inside, like a clean, supple hose that water moves through easily. Over time, particularly in adults over 60, the inner walls of the arteries can accumulate deposits, a combination of cholesterol, calcium, inflammatory cells, and scar tissue that builds up slowly, layer by layer, year by year. The medical word for this is plaque. You may have heard it in the context of heart disease because the same process that narrows the coronary arteries around the heart also narrows the arteries in the legs. As these deposits grow, the channel through which blood can flow becomes narrower. Less blood gets through. Less warm, oxygen-carrying blood reaches the muscles and skin of the lower legs and feet, and the feet become cold. Not because something is wrong with the feet themselves, but because the pipeline delivering blood to them has been progressively narrowing for years. This process is almost entirely silent in its early stages. There is no pain. There is no obvious symptom other than the cold feet that you have already normalized. The narrowing continues without announcement, and the cold feet that you have been managing with slippers and extra socks for 3 years may be the only external sign of something that has been quietly progressing the entire time. Here is why this matters beyond the feet themselves. The same process narrowing the arteries in your legs is almost certainly occurring in other arteries throughout your body simultaneously. The cardiovascular system does not develop arterial narrowing in one location while remaining pristine everywhere else. Adults diagnosed with peripheral arterial disease have a 2 to 3 times higher risk of heart attack and stroke than adults without it. Not because the leg arteries cause those events, but because their presence indicates how widespread the underlying arterial disease actually is. Your cold feet may be the most visible window into what is happening in vessels you cannot see. Now I want to give you 2 practical tests you can perform at home right now that will give you meaningful information. These are not substitutes for medical evaluation. They are tools to help you understand what you are dealing with and to have a more informed conversation with your doctor. The first test is the temperature comparison. Sit comfortably for at least 15 minutes without moving. You want your circulation to reach its resting baseline. Then place one hand on top of your right foot and one hand on top of your left foot simultaneously. Hold them there for 10 seconds. The question is not whether your feet are cold in absolute terms. The question is whether one foot is meaningfully colder than the other. Equal temperature in both feet, even if both are cold, is less concerning and more consistent with systemic causes like an underactive thyroid or simply a tendency toward cold extremities. A consistent, meaningful temperature difference between the 2 feet, one clearly colder than the other week after week, suggests a localized arterial narrowing on the colder side, one artery more compromised than the other. That asymmetry is a finding that belongs in a medical conversation. The second test is the elevation color change. Lie on your back and raise both legs to a 45-degree angle. Rest them against the wall or hold them up for 60 seconds. Then sit up and let them hang over the edge of the bed or chair. Watch the color. In healthy circulation, the color of the feet changes very little with position. In compromised arterial circulation, the feet become noticeably pale, sometimes almost waxy, when elevated, because the arterial pressure is insufficient to push blood upward against gravity into already narrowed vessels. When you lower your legs and gravity assists, blood rushes back in and the feet may flush a deep pink or red. If you see that sequence, pale when elevated, flushed when lowered, that is a specific clinical sign that your arteries are working under pressure to deliver blood to your feet. That is a same-week appointment with your doctor. I want to spend a moment on 2 other causes of cold feet that are common in this age group and are important to distinguish because the management is completely different. The first is an underactive thyroid. Your thyroid gland, a small structure at the base of your throat, produces hormones that control the metabolic rate of every cell in your body. Think of it as the thermostat for your entire system. When thyroid output falls, your metabolism slows. Your body produces less heat. Your temperature regulation becomes less efficient. Cold feet, cold hands, sensitivity to cool temperatures in general, combined with fatigue that sleep does not resolve, weight gain without dietary change, and a subtle slowing of thought and energy, are the classic picture of an underactive thyroid. This is extraordinarily common in women over 60, affecting somewhere between 10 and 15%, and significantly underdiagnosed because the symptoms develop so gradually that each one gets attributed to aging before the full picture is assembled. A simple blood test, TSH, thyroid stimulating hormone, identifies it. And when it is identified and treated, the cold feet, along with the fatigue and the weight and the mental fog, often resolve within weeks. If you have not had your thyroid checked in the past year and cold feet is one of several symptoms from the list I just described, that blood test is worth requesting specifically. The second is Raynaud's phenomenon, a condition in which the small blood vessels in the extremities overreact to cold or stress by constricting dramatically, cutting off circulation to the fingers and toes temporarily. In Raynaud's, the color change is distinctive and sequential. The affected area turns white as blood flow stops, then blue or purple as the remaining oxygen is depleted, then red as circulation returns. It can be painful or numb during an episode and then achingly sensitive as blood flow restores. Raynaud's is more common in women and often begins earlier in life, but it can first become noticeable in the 60s when circulation reserve decreases. It can occur on its own, in which case it is uncomfortable but not dangerous, or it can be associated with underlying autoimmune conditions that do require specific treatment. If you experience the color change sequence I described, white, then blue, then red, in your toes when exposed to cold, that pattern is worth mentioning specifically to your doctor, rather than describing it generically as cold feet. Before I close, I want to address something that I think is the most practically important piece of information in this entire video. If you have cold feet and you also smoke, even occasionally, even lightly, I need you to understand something with complete clarity. Smoking is the single most powerful accelerant of peripheral arterial disease that exists. It damages the inner lining of blood vessels directly, accelerates plaque formation, causes the vessels to constrict, and reduces the oxygen carrying capacity of the blood simultaneously. The combination of cold feet indicating early arterial compromise and continued smoking is one of the most damaging things you can do to your vascular system. Every cigarette after 60 is doing something measurable to the vessels in your legs and in your heart. I say this not to judge, but because I have sat with patients who lost toes and then feet to arterial disease that could have been interrupted years earlier. And the common thread in those conversations is almost always a period during which the warning signs were present and the habits that were accelerating the damage continued. Your feet are cold. Your body is asking for your attention. Give it the attention it is asking for. If this video helped you understand something about a symptom you had normalized, share it today with someone who keeps their slippers by the chair all year and has stopped thinking of it as something worth mentioning. Subscribe to this channel. Leave a comment below. Tell me whether your cold feet are both equally cold or whether one is colder than the other. That detail matters more than most people realize. I read every comment. I am Dr. James Harlow. Take care of your circulation. I will see you in the next video.